Hello and welcome to episode 68 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is CrossFit and low back pain. The most common CrossFit-based movements that tend to agitate lower back issues that you might identify with, and some immediate action steps that you can take to get ahead of these things and to modify your workouts just for the time being so you can appropriately recover and get back to 100% performance. If you have not joined my free Facebook page yet, it is called RehabFix Low Back Program, and you will have exclusive access to myself and my team to ask me one-on-one questions. We're posting exclusive content in there. We have a sciatica guide in there as well, step-by-step sciatica guide. I just released a new low back guide in there just a couple days ago as well that goes over fundamental understanding of low back issues, disc and sciatica mechanics, core exercises, understanding pain. Guys, if you are not on our private Facebook group, you need to join our private Facebook group. We have gone from 0 to about 650 members within just a little over a month, 100% organically. There is gold in there. The link to join this page will also be in the show notes, or just type in RehabFix Low Back Program. Now, let's get into today's topic. We work with a lot of active individuals. A lot of the clients we work with, from all ranges. We worked with a few professional athletes. We worked with a few people who, just want to be able to walk around the neighborhood again with their kids without pain. All areas in between. But as we know, CrossFit is a very popular activity, sport, whatever you want to label it, that a lot of people partake in. It's a lot of people's exercise of choice. And as with any intense exercise or any intense sport of any kind, it can be hard on the body. And so we work with a lot of individuals who have lower back pain, whether it was during CrossFit workout, from a heavy squat, deadlift, or other exercise, and they're finding it hard to get back to CrossFit, back to their 100% performance. And what we've found over the years is that there's a few common movements that most of you dealing with low back issues will notice bother you the most. And so we're going to offer some recommendations right now over these most common things. So let's jump right to it, okay? If you have low back pain and you're trying to get back to CrossFit, you have probably noticed that your low back will be agitated the most when you are doing toes to bar, GHD sit-ups, GHD meaning the glute to ham developer. Your legs are strapped in, you're leaning really, really far back, a lot of extension and then a lot of flexion in the lower back. So toes to bar, GHD sit-ups, or just regular sit-ups on the floor as well. These are some really, really common movements that will flare up the common type of low back, disc, sciatic issues that we see every single day. Okay, and it's really frustrating for these athletes because they want to be able to compete. They want to be able to push themselves. They want to be able to do the workout of the day, and they can't, or at least they have to modify all the time, or they feel like they're not sure what they can do for their back issues. So first and foremost, the individuals who find themselves struggling with these type of movements almost always have flexion intolerant low back issues. Usually the ones where the longer they sit, the more they feel it. First thing in the morning, bending over to put socks and shoes on. When they've been sitting for a long time, they go to stand up. It's really stiff standing up. That's the type of category that these individuals are in. And that's everything that our program is designed on. Now, immediately, these type of individuals need to work in extension-based movements. Absolutely, they need to do extension-based movements. I'm not meaning back extensions or hyper extensions. That's not what I'm meaning. Remember, strength is rarely a reason or a cause for low back pain. If low back pain was caused by a weak core, weak low back, then powerlifters would never get injured. Strongmen would never get injured. Bodybuilders would never get injured, but they do every single day. So that notion does not make any sense. CrossFit athletes certainly are not weak either. So if you are being told that you hurt your low back because your core is weak or because your low back is weak, I would strongly consider that notion, because most likely you hurt your back because you're pushing yourself hard. Anyone who's pushing themselves hard in CrossFit is not a weak person. Okay, so that's not what I mean. A lot of people who actually do a lot of back extensions notice that it makes their situation worse. So Anyway, extension-based work. Now, how can we modify these movements for the time being so that you can stop agitating it all the time, but you can stay in your workouts? Here's the goal here. You don't want to be taken out of your workouts. You don't want to be told by your doctor, oh, you need to stop squats, stop deadlifts, stop working out. That's what most of our clients have been told. Never a solution. Terrible advice. Okay. So how can we get you back into your CrossFit workouts, but in a way that you can still push yourself, but you're not going to continue to flare up and flare up and flare up and flare up every time with these main movements? Toes to bar. Toes to bar is a swinging, flexion-based movement of the lower back, lifting your legs up to put your toes to the bar. Very simple modification you can make for this, although maybe not as satisfying, is simply hang, bring your rib cage down a little bit, close that rib cage down so you're obviously activating the core. But instead of swinging your toes to the bar, just simply do a controlled knee raise. Okay? I know it might not sound fancy. It might not sound like exciting, but it's a way for you to still perform the movement with everybody else without just flaring yourself up every single time. Remember, this is a recommendation so you can stay in your workouts and you can get ahead of your rehab. We don't tell our clients to stop working out in our program. We actually encourage our clients to work out. We just modify so that we can keep them in the gym without flaring themselves up. And we can actually get the rehab to work and do its job. So for the time being, you might want to just do a controlled knee raise. Rib cage down, posterior tilt in the pelvis. Just raise the knees. Don't swing the legs, just raise the knees. You're still going to get a good core workout. I promise. You're still going to get a good core workout, and that's a way for you to not flare up yourself every single workout. Okay? Or if you're like, you know what, I want a little bit more than that, then here's what I recommend. Once again, rib cage down, posterior tilt. Do a hollow hold. Do a hollow hold. Okay? So it's almost like the initial stages of a muscle up, right? Just the very initial stage, a hollow hold. Hold the hollow hold for time. Okay? Hold it for 5 seconds, 10 seconds, or do it for repetitions, holding it for 2 seconds each time. Maybe you do 2-second hold and you do 5 to 10 reps. Okay? That's going to destroy you. I promise. Destroy you in a good way. You're going to feel your core work. You're going to be sore. You're going to feel like you got a good workout, but you're not just going to crank the low back into flexion over and over and over, just flaring yourself up every single time. You don't want to have a setback every single time you work out. You want to be able to work out without having setbacks while also being able to implement your rehab so you can get ahead of the rehab and you can actually recover appropriately so that you can work out and do CrossFit and everything you want to do to 100% by the end of your rehab program. That's the goal. Now, regular sit-ups on the ground. If these are programmed in your workout, I would recommend doing a dead bug instead, or a reverse crunch. A reverse crunch is literally what it says. Instead of your legs staying on the floor and you picking your chest up off the ground to bring basically your chest to your waist or your chest to your knees, you're going to do the opposite. You're going to keep your low back and your whole spine flat on the ground, and you're going to bring your knees to your waist, or your legs to your waist, your knees to your chest. You're going to do the opposite. So this is a way to avoid repetitive load and flexion in the lower back. So you're not sitting up and cranking that low back every single time. You're able to keep your low back flat on the ground neutral, keep your knees bent, pick both feet off the ground at a time, doing a reverse crunch. You're going to feel the core work, I promise. You're going to get a good burn, I promise. And you're not going to flare up your back every single time. Now, the GHD setup, glute ham developer setup. That requires a lot of movement of the spine, movement under load. You're in loaded flexion, loaded extension. It's a lot of movement. This is one of very, very few that I would say, you know what, if you're flaring up every single time, I would probably just cut this one. I don't have a seamless modification for you for this particular movement, unless you're just drastically limiting your range of motion. I would only lean back to the point where you can maintain basically a hollow hold type position. You can maintain neutrality. I would not swing past that. Once again, if you're flaring up every single time. If you have a great healthy spine right now, you can work out, you can push yourself, then none of this applies to you. None of what I'm saying applies to you. But if your low back is really achy and you feel like you're flaring up after all your workouts and you're able to modify the other things so you can stay in the workout, that's awesome. But the GHD sit-ups, that's a tough one. I would recommend taking just a momentary break from those so that once again, we can advance your plan. You can get ahead of your rehab. And then you can return to the GHD sit-ups, maybe in a matter of just a few weeks. And then you're like, oh my gosh, I can do these again. Perfect. Now we'll start at a low load. We're not going to say, all right, go ahead and jump right back into, 3x10, 5x10. No, let's sprinkle it in there. Okay, maybe we just do, 5 reps the first session. Maybe that's it. Maybe we do 2 sets of 5 reps the next time. Maybe we do 3 sets of 5 reps. And then 2 sets of 10, 3 sets of 10. Slowly rebuilding that movement so you can expose your body to that load for adaptation purposes. That's a great way that you can get back into GHD sit-ups ultimately. Now, other movements that commonly irritate individuals with these types of flexion-tolerant lower back issues are obviously going to be deadlifts and squats, depending on the person. Not every person, but usually they're a little bit timid of deadlifts and squats, and overhead squats as well. Overhead squats can be quite tough, once again, because that's in a loaded extension, a lot of hyperextension going on throughout that movement, kind of doing a lot of that compression type feeling. Once again, the same reason why back extensions and workouts like that usually aren't helpful for lower back issues. They usually flare them up. So those are different topics. Those are different cues. There's different rehab approaches I would use for those. We can cover that in a different video if you guys like. Comment below if you would like that. But today I just really wanted to focus on the most common core movements that trigger individuals with the most common type of lower back issue that we deal with, which are loaded flexion-based movements, and some modifications that you can make to at least get through those workouts and a better understanding of maybe why those are flaring you up, and a way to integrate a particular break or particular modification sequence so that you can get ahead of rehab, you can get back to training 100%, because that's what we want for you. We want you to be back to training 100%. And if anyone is telling you you can't squat, can't deadlift, can't do CrossFit again, they're crazy and they have no idea how to properly manage lower back issues. And I highly advise you to go somewhere else or just come straight to us and submit an application, reach out to us on our Facebook page. Let's talk about your current situation and how we can get you that plan that you're looking for. Because remember, 6 months from now, you can either have 6 months of progress or 6 months of no progress or 6 months of excuses. You don't want either of those other two. You want 6 months of progress. So I'd love to see you back training CrossFit, pushing yourself again, and not continuing to flare up and flare up and flare up with every workout, not able to push yourself to the limit that you would like. Once again, join our private Facebook group, RehabFix Low Back Program, so you can be surrounded by individuals just like you who understand where you're at, and you can find more tools for how to resolve your lower back, sciatica, and disc-related issues. If you are watching on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review. That is a free way to give back to this podcast to help these episodes get noticed. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.